Bismillah ar-Rahman ar-Rahim. Good morning and Assalamu alaikum, ladies and gentlemen. I am Lieutenant General Haroon Aslam. I have the honor of serving as the President IMARAT Institute of Policy Studies, commonly known as IIPS. IMARAT Institute of Policy Studies is a research and policy institute in Pakistan based in Islamabad, focused on conducting studies and providing insights into various sectors such as real estate, tourism, hospitality, and the economy. It serves as a think tank producing research reports, blogs, and publications to support evidence based policy making. Today, I'm delighted to welcome you all to this insightful webinar on senior citizens, life lessons, and modern day challenges. In a rapidly evolving world, the wisdom and experiences of our senior citizens remains invaluable. However, they also face unique challenges in adapting to modern realities. It is imperative that we explore ways to bridge generational gaps, provide support, and celebrate the contributions of our elders. This session brings together experts and practitioners who will shed light on various aspects of this critical topic, helping us understand the lessons can learn from senior citizens and the challenges they encounter today. Together, we'll discuss, learn, and share knowledge to foster a more inclusive and supportive society for all generations. Let me introduce the panel today. We are honored to have Professor Dr. Asghar Zaidi, Provost at the University of Management and Technology and a global leader in social policy and aging research. Previously, he served as Vice Chancellor of Government College, University, Lahore, with a PhD in economics from Oxford and over 35 years of experience. His work includes 5 books, numerous research publications, and reports for the UN and European Commission. He'll be speaking on comforting senior citizens living with dementia. Next, we have Mr. Shafqaat Ahmed, a veteran banker and financial professional with a 45 plus years of experience, including 25 years in Islamic banking. His expertise spans financial markets, risk management, and treasury operation, and he has served on the boards of National Insurance Company, State Life Insurance, Al-Baraka Bank Pakistan, and Takaful Pakistan. A certified director from PICG and LUMS and Lahore University, he will be speaking on staying fit after retirement. We are also joined by Dr. Safdar Sohail, a former civil servant, policy expert, and academician with 39 years of experience in governance and trade policy. He has served as Pakistan's economic minister to the EU, Director General of the Pakistan Institute of Trade and Development, and led key CPEC and trade policy initiatives. Currently, he is Executive Director of the Social Protection Resource Center, advocating for social protection and elderly care. He'll be speaking on policy and implementation gaps in elderly care in Pakistan. We have Ms. Shahida Jamil, a barrister and a former federal minister for law, justice, and human rights in Pakistan. She has over 25 years of experience in legal practice as an advocate of the High Court of Sindh and Punjab. She will be speaking on the topic legislation for facilitating the lives of senior citizens. First of all, I would request Professor Dr. Asghar Zaidi to please take the floor.
Thank you.
Over to you, sir.
Thank you. Can you share my slides? How would we work out? Would you?
We will, sir.
Yeah. Okay. Excellent. When I would say next slide, please do move to the next one. Bismillah ar-Rahman ar-Rahim. I'm really honored and I'm really privileged that I will be one of the panel speakers in the Emirates webinar today. And it's a very critical topic. We all know this. And what I want to do, and this is a somewhat deviation from the topic that I originally agreed, but I would still, I would give my arguments why this topic at the moment is much more relevant and critical. So I will be talking about WHO's concept of healthy aging. And many of you would know that WHO has declared this decade, which started in 2021 and will continue till 2030. WHO has, in agreement with the member countries, has declared this decade of healthy aging. So, and this falls within the context, within the mandate of Development Agenda 2030, which we know through its Sustainable Development Goals. So, because this concept and its implementation has become extremely important in the context of SDGs, I wanted to speak briefly today how this could be implemented in the context of Pakistan. And I know other people, especially Dr. Safdar, Sohail, Madam Shahida Jamil, and Shafqaat Ahmed Saab, you will also be reflecting on this matter. Continuing, and I will at the end draw some conclusions referring to the dementia challenge. So I hope you will accept that a little change of topic. So the first question is, what is healthy aging? But before, can we move to next slide? Before I go on to make a full presentation, may I give you the takeaway messages? So these are the conclusions which I would have drawn at the end of my presentation, but I want to mention them right at the outset because that will define the agenda of what we are talking. So all the other details would lead to these two conclusions. And the first one is there is no delay we should have. We should urgently adapt the policies, our policies, existing public policies, so that we could support a rising number of older population in Pakistan. Next. And that we can do by adopting WHO's healthy aging principles, which implies that we should have better geriatric healthcare, we should have better social pensions for all, and we should come up with age-friendly environments in our country. And by doing so, we can ensure a dignified, independent, and healthy status for our older population. Next. So what is healthy aging? And many of you would most likely know this definition already. It talks about a process of developing and then maintaining a concept called functional ability. Many of us can understand such a concept, that how do we go about carrying out our day-to-day tasks. And these functional abilities should enable a higher well-being in older age. Next. And what do we mean by functional ability? It is shaped by intrinsic capacity, which is about physical and mental health, and to large extent determined by our lifestyles during earlier ages, but also by provisions of preventive care, and that determines our physical and mental health, which we refer to as intrinsic capacity. But the second factor is environmental factors, which are about what public health care policies are available, what family support is available in the culture of the country that we live, and what age-friendly infrastructure might be available around it. So you can imagine that intrinsic capacity could be affected almost the same way for many people getting older. But when those intrinsic capacities interact with public healthcare policies, with family support available, with age-friendly infrastructure around, then we become more functional in our old age, despite frailty, despite occurrence of more often disease. So this is the interaction of our intrinsic capacity with the environment within which we are living. So if we are aging in Lahore, that would be different than aging in Stockholm, because the environmental factors are much more supportive to older persons in Stockholm. And then the third factor, which is probably the most important, is the personal behavior. And those are not just the personal behaviors once we have reached old age, but it's a lifetime phenomenon that we need to watch out what we eat, how often we do exercise, and what kind of social relations we live with. Next. So basically, WHO's healthy aging concept is helping us take the focus away from increasing life expectancy to ensuring that older people remain independent, active, and contributory towards their societies, towards their families, towards their communities. Next. So those were sort of initial context, but let's look at what is the Pakistan's context in terms of number of older persons. And we see that in the current period, the latest credible data that we have is for 2023. That tells us that there are, in single digits, 7% of people are age 60 or above. Age 60 or above can be contested to be the definition of old age, but this is the definition that is used by UN statistical offices, and this is the definition very often used in our statutory retirement policies, certainly in Pakistan. But I would disagree that age 60, in my view, is too young to start calling people old age people. But using that definition, we see that from this day to 2050, in 25 years' time, the population of older persons would rise from 16.5 million to almost 36.5 million, 3 times as much. This is real concern. And in some presentations, I say that a tsunami is waiting to happen. We are aware it will be happening, and we are doing very little to actually prepare for it. So today's seminar in that respect is also extremely relevant, and we are very thankful to IMARAT for organizing this awareness seminar. Next. If you look at the life expectancy, we could see that the life expectancy is on the rise. From this year to 2050, we see, for instance, let's just take one example of females. So females' life expectancy is rising from approximately 70 to 74 years. So in this period, we are observing 4 additional years added to the life of our females, and similar figures you could say for males, slightly less, maybe 3 years. So healthy aging concept is WHO's healthy aging concept implies that we need to really add life to these years, to have more healthy life added to these years, and that could only happen if we bring about certain changes that would help us implement healthy aging. Next. So I'm just focusing on recommendations. I'm not going into any further details. First and foremost, the geriatric healthcare needs improving. And this means more doctors should specialize in geriatric medicine. We should establish specialized healthcare units for older persons, and we should expand health insurance for elderly population. So these are, and we know that given the current system, there is very little specialized care for older persons. And given the rising number of older persons, we must bring about this improvement in our healthcare system. Next. We should also expand our social protection. And this means we should implement universal social pension schemes. We should provide social assistance, financial assistance for low-income seniors. We know income is one of the strongest predictors of people being active, engaged, and healthy in old age. So this will need to be strengthened as well. And I'm sure Dr. Safdar will be talking further about this. Next. And it goes without saying. I heard that Dr. Shafqaat and Dr. Shahida, Madam Shahida, will be talking about this as well. We need to bring about changes in our lifestyles. And this is not just changes for older persons. This should be middle age, early age, young. We should have better lifestyles in terms of diet, in terms of exercise, in terms of social engagements. In particular, in old age, we should come up with community-based programs. So I live in Model Town in Lahore, and I'm suggesting, and I see lots of groups active in the Model Town Park, and I'm suggesting more of such community-based programs should be implemented so that people in old age continue to live a healthy lifestyle. And we should also come up with public health awareness campaigns to combat ageism, because very often the mindset is that older persons do not need to do all this. They should just sit at home and not be as engaged as healthy aging principles are implying. Next. And of course, we should strengthen elderly care services. And that means especially for those who require home care, but we also need to provide caregiver training for families. Last slide, thank you, please. Thank you. Next one. And I bring about all this, that we need to establish a National Commission on Aging to coordinate public policies in private sector, public policies and private sector initiatives. Next. And all of this will happen if we, to start implementing and enforcing senior citizens welfare acts, which are in place, but they are not implemented or enforced across all provinces. To my knowledge, they have been implemented or put in place in KPK and Sindh, but there is very little implementation of it. Thank you so much. I am so privileged and pleased that I got this opportunity to talk about this work. And you could see one last minute that this will have impact not just for those who, having adopted healthy aging, will not just improve our physical health, but also improve our mental health. That means it would delay the onset of dementia for older persons, and it would, for some people, it would help them to stay away from this terrible, terrible disease. And even when they are suffering from dementia, the healthy aging principles tell us that we need to find ways to keep them engaged and keep them stimulated, keep them active in our social community initiatives, because in that way their quality of life gets better. Thank you so much.
Dr. Saab, thank you very much for your very good presentation, very incisive, very informative. May I ask just a question that what is the age bracket that one can be categorized as amongst the senior citizens? Does it differ from country to country, environment to environment? Because we generally hear that, oh, age is just a number. One should feel
Absolutely.
young, and when you tell a person you're elderly, you're senior citizen, it would have that psychological adverse
Yeah.
effect also.
I mean, as an academic, I do not think there is a single age beyond which we can say you are old and those below it would be not old. I think it depends on functional ability. Those who are able to carry out their functions do not need to be referred to as senior citizens, or at least not viewed as inactive and not requiring engagement and activities. But I think on the whole, we need to take out this ageism in our references, as if calling someone old age is accusing him of something or accusing a, so there is this negative connotation attached to old age, senior citizens, and that's a form of ageism that we need to get rid of. I'm happy to be called old age. I'm hardly 60. I don't think old age is a bad tag to have. In fact, I think old age has actually brought so many positive attributes in me. I'm so much better person having had that age behind me. So it should have a positive connotation rather than a negative connotation. But statistically, coming back to the original question, I think statistically we have to define a line somewhere. If you want to record what number of older persons we need to have, for that statistics purpose, we need to have a line. Sometime the line is drawn at 60, sometime it is drawn at 65. In some countries, the age of retirement, the statutory age of retirement is 60. So it's fine to use for statistical purposes that age threshold. But in other countries, now in the UK and in Scandinavian countries, it's actually well beyond 65. In some of the countries, it's 67, and there is a proposal to take it to 70. So it's fine to define a sort of different age thresholds for different countries. But if you want to have global statistics and want to compare countries, perhaps you want to draw a line at either 60 or 65.
Yeah. One interesting statistics you gave, Doctor, was that the age expectancy of ladies is more than men. So we'll be seeing more of ladies in future in our country.
Yeah.
Uh,
It's
Dr.
already.
Shahida, would it be if I suggest you cover it in your presentation, what effects will it have on our society and in our household?
It certainly
Otherwise,
will.
also ladies are dominant.
Yeah.
Uh,
It's
Dr. Saab, thank you very much for
Thank
your
you.
presentation. We would have loved to see you in the discussion also, but some other time we'll rope you in for a very interesting subject you have touched.
Thank you. I will stay in as long as I'm not called for this other meeting.
Okay,
I will
okay.
continue to be part of the discussion.
Wonderful, sir. Wonderful. Now I would request Mr. Shafqaat Ahmed, sir.
Assalamu alaikum
It's your
ji,
turn.
everybody. Uh, First of all, I would like to thank Emirates Group, in particular General Haroon, for regularly organizing these webinars and seminars on various issues. And I hope they will continue doing this, because it is bringing a change in the society. People who share the views of these senior people, experienced people, so they definitely are benefited. Coming to today's topic of senior citizens, life lessons, and modern day challenges, I think first of all, let's have a look at how these citizens the senior citizens are treated in developed countries like USA, Canada, European countries, and even now Middle East. In these countries, there is proper legislation, and those legislations are strictly implemented, and the senior citizens of these countries enjoy different privileges, which includes and not only limited to financial assistance, free medical coverage, concessional travel facilities, of course, within the country, subsidized medicines and other important items of daily use. Housing is another area which is provided in the shape of old people homes. Now, if we compare our country, Pakistan, there are certain rules, regulations about senior citizens, including an act which was passed in 2021, 4 years back, which covers all facilities of financial assistance, medical, subsidized items of daily use. But surprisingly, this act's jurisdiction was restricted to only ICT, Islamabad Capital Territory. I'm still wonder what is the idea, why it was restricted to only one city of Pakistan, Islamabad. And I'm not sure. The act is there and it covers each and everything. But is it implemented even in Islamabad? I'm not sure. I mean, if there's somebody from Islamabad can always tell us. Another factor about the senior citizen, as Dr. Asghar has also mentioned, there is a social taboo due to which a majority of people who fall in this category of senior citizens do not want to be identified as senior citizens, especially the ladies. I mean, I'll give you an example. I mean, if you go to bank where there are certain counters only for specifically for senior citizens, but even senior citizens would not avail that facility or concession and stand there, and would prefer to stand in the normal line, because we think, as Dr. Asghar also mentioned in his presentation, but as far as I'm concerned, aging is a beautiful process. And as he mentioned, that only 7% out of the total population of Pakistan survive after the age of 60 or 65 years. So it is indeed a privilege to be a senior citizen and to enjoy the fruits of the age after 60 or 65 years. Another thing is that, as Dr. Saab said, 60 age should not be the benchmark for declaring somebody a senior citizen. I think it is basically the circumstances of the individuals or various people which makes a person a senior citizen even at the age of 50. And there are people who are at the age of 80 are cannot be categorized as senior citizen. I mean, we have a very live example of Sayyid Babar Ali, who at the age of 98 is still going to his office, attending everything, and mashallah, enjoying good health, everything. So out of these 7%, I think the actual number of people who would be requiring the government's support and care would be even much less than this. I think the major factor in our country about the senior citizens is the financial stability. If a person is financially sound, I think he health-wise, other things, he will be better off than a person who is retired, doesn't have enough resources, and then he feels a little bit a difficult situation, and his problems increase, and such people require support of the government and the public level. Now coming down to the my specific topic, which is how to remain fit at this age. Everybody wants to be young, healthy, and fit in old age is a goal for everybody. However, there is no one size fits all approach, but there are certain common things which if one follow, then I think they can have a comfortable and healthy old age. The first of all, they must have regular physical activity. So engaging in regular exercise is vital for maintaining physical health, strength, and flexibility. It can help reduce the risk of chronic conditions, improve cardiovascular health, enhance overall well-being. Activities such as walking, swimming, strength training, and yoga are excellent options for seniors to stay active and fit. Personally, I mean, if somebody has the privilege and access, he can start playing golf, which will give him not only the physical activity, but also a little mental relaxation. Those people who play golf, they really can appreciate this. Another factor which is important for having a healthy old age is the balanced and nutritious diet. As we all know, a healthy diet plays a crucial role in maintaining overall health. It is important to consume a variety of nutrient-dense foods, including fruits, vegetables, whole grains, lean proteins, and healthy fats. We must avoid excessive processed food, sugary snacks, and oily things, and try to be more on vegetables and fruits. The third major factor is the mental and cognitive stimulation. Keeping the mind active and engaged is essential for healthy aging. Mental stimulation through activities like reading, puzzle, learning new skills, and special interactions can help preserve cognitive function and memory. Engaging in lifelong learning, such as taking classes or joining discussion groups, is a great way to stay mentally sharp and foster personal growth. The next factor is the adequate rest and sleep. Sleep, I think, is a very important aspect at every stage of life. I mean, whenever you go to a doctor, I think the first thing he asks है आपको भूख लगती है और नींद आती है, आपकी नींद कैसी है, ये भूख कैसी है. So if somebody is enjoying good sleep and eating well, तो डॉक्टर बहुत सी चीजों को they rule out many things. So a proper sleep, and especially at the age when we are about 70, 65, and as we said, senior citizens, 7 to 9 hours sleep is a basic requirement, and a quality sleep. Not only that we are lying on the bed and doing things, it should be a quality, peaceful sleep. Then the last major item is the social connections and emotional well-being. Basically, at this age, the worst thing is the loneliness. We are, even if you are living in a family, everybody is so busy nowadays that it is very difficult that they can give you time. And especially in our culture also, in very old people, it is people don't have much time for them. So they should engage in some community welfare, some NGO should join, they should work somewhere. And the most important thing is that they should have a good friends where they can go, they can sit, they can talk, they can laugh, and they can do, they can talk anything, because that is the main thing which will keep them going. So these are some of the things which I just want to share with you, that if we want a healthy and a fit life as a senior citizen, we have to abide by these things, and we should follow them. Sleep well, eat healthy food, do some physical activity. So these are the basic requirements. Of course, the major factor in our country that is the financial stability. So with these things, if somebody has financial stability, they can have a very peaceful life as a senior citizen. But here, a major problem is what I see is the financial stability. Thank you very much. This is what I wanted to share with you, and leave it to Jan sir.
Sir, thank you very much for your very good talk on what must be done in the old age to remain fit. You mentioned about regular physical activity, diet, and you said you recommended that we should keep our mind active, sleep well. The Japanese theory I read somewhere is that if you want to live longer, you should sleep longer.
Okay.
I don't know how far is it's true, but I read somewhere. Sleep is very important, sir. And then you said that we should maintain social connection, a feeling of loneliness. I was in serving in United Nations in Georgia, and our landlady and landlord, they were elderly couple, and they had a family, but they used to be alone. And he said that I said, your family doesn't give you much time. He said, look, remember that it is a universal phenomenon. In his own broken kind of English, he said, and he said that they said that love has to move forward. Your children are busy in giving, taking care of their family, their offspring. The love is moving forward. So ultimately बुड्ढा बुड्ढी अकेले रह जाते हैं और इसी की तैयारी करना चाहिए. So, and we should be mentally prepared for that. I go in this few colonies जहाँ मेरे profession के लोग रहते हैं, and there in the evening the upper story is all dark. Nobody lives there. Children have gone. और नीचे वाली स्टोरी में जो घर बनाया था उधर वही जो कपल, ओल्ड कपल, elderly couple are staying. These are facts of life, and one should not, moan and complain about this. I recommend that the life should move on. And a very important point is the financial adequacy at this stage, Shafqaat Saab said. And I think I would like to concur that point. Basically, when there is, in the developed countries, if they don't have a financial kind of protection, the state gives that. State takes that obligation of stipends and pensions and all. Sir, without losing much more time, over to Madam Shahida Jamil. Ma'am, floor is yours. And ma'am, your mic is off. Your mic is off.
Thank you. Thank you, Dr. For this opportunity. I think the topic is extremely important because it actually, it is a very important area that exposes a major weakness in our system. The story of Pakistan is really a slightly depressing one in this matter because we have a governmentally controlled economy. So private enterprise is very much, to a large degree, hampered. Either the state takes money from them directly, asking them to contribute to floods or contribute, takes it away, and therefore there's not much to go around in the real sense of the word, unless it's religious. So what we have are the lack of foundations in this country. In other private sector societies, successfully organized societies, you have huge funds lying within the system because private sector is very, very active. And it is allowed to be active. There's ease of doing business. In Pakistan, that is not the case. We have a struggle on here between a socialist mindset and a private sector mindset. So you see that in pre-partition, we had a lot of homes set up by the British colonialists, like Lemon's Home in Karachi for the aged. And you had these few that were run by the missionaries, whether they were Protestant or they were Catholic. Then by 1961 came the Social Welfare Ordinance. And with the Social Welfare Ordinance, there was an attempt at registering by governmental control all these societies that were functioning, that were called the Societies Act, under the Societies Registration Act. So they brought in control, and under that control, there were quite a few invasive powers given in that ordinance. Then we got the Social Security Act in 1965, we got the Employees' Old Age Benefit in 1976, and you see a sudden stop. Then in 1982, the world came together, and the first World Assembly took place, and this issue was raised, the agenda for the aged and the various dimensions that are required. This huge mobilization, universal, had a slight impact because in 1983, some private sectors did respond, like Al-Mustafa Welfare Society, and set up old homes. They got themselves registered under the Social Welfare Ordinance, and they started work. But then there was again a stoppage. And you see a series of declarations from about 14 international declarations. They start from Vienna, then they go into Montreal, then you have the World Population Plan of Action in 74, you have it in 1982, in 83, 99. There's a plethora right up to 1995. And we have these huge declarations. So you see an international agenda coming to being. And what happens? With that international agenda, there are donor organizations that move into that free world sector. And of course, they are the ones who are supporting. They start giving donations. They start funding all these programs. Pakistan mein kya hota hai? In Pakistan, in 1999, we make our first national policy. Then by 2002, we do become signatories to the UN Madrid International Plan of Action, Aging 2002. And then it's ratified by General Musharraf's government. We go along, and of course, we find that the paradigm shift from elderly is now moving in Pakistan into senior citizens. Basically, we are trying to adjusted to our cultural thinking, buzurgi ke saath, which is a good move. That was not a bad move at all, because it gave a certain status to that category of citizens. 2004, special package was set up. By 2007, the bureaucracy sitting in Islamabad, and that would, Dr. Shafqaat साहब, आपकी जो बात थी उससे जरा सा ये पहलू आता है कि जो senior bureaucrats sitting in Islamabad, they had actually drafted a senior citizens welfare bill, but nobody was listening to them in that sense, because it was a pretty heavy, sensible bill. So I was lucky. They came to me because they knew me from the English-speaking union. And before we knew it, we got heavily into it, because I was then the Minister for Social Welfare and Special Education. We got directly into it. And I began to look at this bill. In the meantime, I had also another group that had come to me on the basis of the children's issues bill. I noticed something which I wish to actually bring to everybody's notice. But first, let me get through this. We prepared the bill, but what I said to them was that all we can do, because we're a caretaker cabinet, we'll prepare the bill and leave it for the elected group that comes in to decide, because we can't take that decision. We're only there for 3 months. So we made it, I made it, we got it finalized, and it was sent to the Ministry of Social Welfare. Then we see comes the 18th Amendment. There's a complete silence in this bill. 18th Amendment, and in 18th Amendment, broke it up. We broke it up, we fragmented that thing. We fragmented it, and again, a lot of intrusive powers of government were folded into the law. So we get the KP Senior Citizens Act 2014. We have the Sindh Senior Citizens Welfare Act 2016. We have the Islamabad Capital Territory Senior Citizens Act 2021. We have the Balochistan Senior Citizens Act 3 of 2017, but Punjab is still lagging behind. It still has a bill that has not yet been passed, but there's been news that they are processing this earlier. In the meantime, in 2021, they brought in the parental ordinance. So protection ordinance. That sort of gave certain legal protections that you couldn't be evicted, you couldn't be thrown out. But that has created a lot of confusion in the law, because we never think that if we bring a bill, how will it impact on other issues, which is called cross-referencing. And we are very, very negligent in cross-referencing. So it results in a complicated situation, and that bogs down the law. That's one aspect. But then what I noticed when I was looking at all these drafts, these models that were being brought, one pattern comes through all the time. And that is, they're only interested in setting up a fund so they can get international funds and attract them. So those provisions are very, very effective. They are full of powers. They can go out and get it from UNDP and from World Bank and Asian Development Bank and say, wahan se funds lana. Accountability nahi hai. Because the audit that is published is only going to go to the government. It's not going to be published in the papers. So in other words, there is no transparency. The funds disappear. They disappear into workshops, into conferences, etc. We don't see it coming down to the people that need it in real terms. So we don't see funds actually set up. And in those laws, it is written that the expenditures of the council that they create, that council's expenditures will also be met by that. So the government's quota or contribution is not specified. It's opaque. The government shall. How much? 1 rupee? 1 million? 10 million? No idea. It depends on the availability of resources. We usually hear that word. So the result is basically trying to get international funds. And then the council is also a very lucrative setup. Through putting up these offices, they are able to give political favors to their favorites, to their political supporters. Isko chairman bana diya, usko secretary bana diya, usko committee ka head bana diya, usko. The result is political favors are handed out. But what do they actually do? That is what I would like to just point out, because I know time is not there. Let's look at, you were talking about Khyber Pakhtunkhwa. Yes, Islamabad has been given its own setup because of the 18th Amendment. Islamabad Capital Territory has become a territory, provincial government on its own. Therefore, it has its own law. So we start with 2014 Khyber Pakhtunkhwa. Pakhtunkhwa mein kya hai? This is an interesting model. The model is composition of the council in all the acts exist, but they are with heavyweights. With the heavyweight Minister of Social Welfare, Secretary to Government, that is Provincial Secretary, 2 members from the Treasury benches or the opposition, Secretary to Government Health Department, Secretary Planning, Secretary Finance, Secretary Government, Local Government, Secretary Commissioner Peshawar Division, Director Social. You know, these are high-level ex officio posts. When they come in, they don't have time. So what has been the experience in the social welfare department is with all these highfalutin VIPs sitting who have to convene for a quorum, which is half the or 1/3, then they are never able to come. The result is meetings are not held because this is never given a priority. These things are not disabled children, not given a priority to that extent. Ministers calling, chief ministers calling, prime ministers calling, they're gone. At the federal level, it's in that problem. And in the provincial level, again, too highfalutin. They should be having a different system. If you look at the structures abroad, they're completely different. They have eminent citizens who are active, who are keen, they're brought in, and they are given the powers to do some work, and they are held accountable. Hamare yahan aisi koi cheez nahi. Nobody wants to be accountable. Everyone wants to give favors, gather money, and then, of course, distribute it to wherever it goes. So we have what we call overloaded councils. And what do? Take steps towards introduction of geriatrics as part of the syllabus. Now just try and listen to the sentence. Take steps towards introduction. I mean, exactly what is the implementation? This is just vague. You're going to take a step. You could take 1 step. You could take 2 steps. You could take 10 years to do this. And to introduce geriatrics as part of the syllabus, why did they have to give such a long-falutin thing? Because there's no intention of functioning. They'll have to do planning. They'll have to do database. They'll have to work it out. They'll have to create the syllabus. They don't want to do that. Then you have mobilized financial resources. This is their job of the council. So political favors and go collect money. Coordination with government and international social and welfare organization at the national, but international level to take steps for the welfare, not to actually give the welfare, but to take steps for the welfare. So in other words, there is no legal liability to do things when you get the funds. The legal liability is weak. It is evasive. It is obfuscating. It is vague. The result is it's not, you can't tie it down to something. Therefore, it's open. It's okay. It's fine. There's no implementation. Establish senior citizens' home to accommodate homeless, because this is how you're going to actually justify the funds. Then they have the power in all the 4 acts to have officers and employers. And who are they? Advisors, consultants, experts. And they will give them money on such terms and conditions as may be prescribed. So you've got a huge platoon in the 4 different provinces of experts, of advisors, consultants, experts. They're all loaded onto the international fund that you have received. It's all dissipated. It's defrayed. Whatever money we get is defrayed. And if we don't get it as a grant or a donation, and we get it as a loan, then it becomes part of the debt, circular debt in the end. And we don't see anything on the ground. And this kind of thing says, for instance, in the KP, the fund shall be utilized for the establishment charges. Why? Where's the government? Where's the provincial government? You want to control everything. You have not allowed any real private sector to grow in the right sense of the word. And in this kind of stifled environment, you don't even want to play your role. So what are you doing? These are questions that all the 4 legislations have. I wish actually I didn't know that you would allow a presentation, Dr. Saab. Otherwise, I would have put this on the slide for everybody to see for themselves and work it out. But if I had no idea that you would allow a presentation, next time, any time you do call, I will try and put it up as a presentation for whenever we discuss. Same thing with this act, Sindh. And then Islamabad Territory Act is little more sensible than all the others. It's very much like the KP Act, but there are certain aspects. That reason is because there's an urbanized, aged population of bureaucrats sitting in Islam. You can't play games with them. They know how the game is played. They know the inside out. Therefore, it's very carefully constructed. So it is the one that I found most amusing, in the sense that it's carefully constructed, but they all know there is the game of opaqueness and defrayment of funds and increase in the circular debt. This is what I have noticed in the legislation. And we've got to stop this nonsensical legislation. It's going to kill this country. Thank you.
Madam, thank you very much for such a nice talk. What amused me was that you're a member of the English-speaking union, and that fluency in your English and that bite, legislature's bite, that is still there because you have been a member of the assembly. Madam, thank you very much for your talk, and really, it's very disheartening, and it's a shame that we do legislations to attract funds, and then the funding is not spent in for the right cause. That is the dilemma, and that is a disease we are living with. The loans and grants are just frittered away. And I worked in an organization where there was a lot of such funding coming. And when I went there, I stayed there for not for a longer period. So there are fundings and which are utilized for if a seminar is to be held in Burban, Specie, the rooms are booked there. And I was told, Sir Jan Saab, there's a room for yourself and your family. I said, who's paying for that? I said, no problem of paying. So these are a problem at the national level, and the society and state both are
And
playing.
provincial, sir, and at the provincial level, very much at the provincial.
True. So thank you very much. This आपने एक लफ्ज इस्तेमाल किया था कि अभी हम बुजुर्गी की तरफ जा रहे हैं, तो ये अच्छी बात है. और ये पहले बताया गया था कि यहाँ कहा किसी ने कि perhaps Dr. Asghar said that he's enjoying after graying of the hair, he's enjoying that status, and that is really a good thing to feel. Thank you very much. Now, I would request Dr. Safdar Sohail. Sir, please switch on your video and audio. And he's going to speak on policy and implementation gaps in elderly care in Pakistan. A very important subject. And sir, over to you.
Yeah, thank you very much. I cannot put on my video. It says that the organizer has disabled it.
देखो भाई.
Yeah, अब ठीक हो गया. This is fine.
Sir, हम आपको disable कैसे कर सकते हैं, sir? You are going to actually sum up everything.
God bless you. First of all, thank you very much for choosing this topic for discussion. All the previous speakers have highlighted the significance of this topic and made wonderful, valuable contributions. I'll basically be building on the presentation of Minister Sahiba, former Minister Sahiba, because she has extensively worked on the subject. But before that, I'll give a brief context of our own work. As you said in introduction, I have been a civil servant, but with the sociologist's heart. I have a PhD in sociology from France, so I have taken interest in these subjects in general, otherwise also. And then I was Pakistan's economic minister to Brussels in EU, and there we got free market access in exchange of our promise to genuinely implement the UN conventions, rights conventions, there are many which we have signed. So that brought me in closer contact with the rights landscape in Pakistan. So after I retired, I did not join, went back to the government and established this think tank called Social Protection Resource Center. And we work on social policy issues with a big focus on disability and elderly. Right now, for the last now 20 months, we have a pro bono engagement going on with 5 federal government ministries to make Islamabad a better place for the disabled and elderly to live. The format is that we identified the sticky problems that both of these populations have, and then sat with Ministry of Health, with Ministry of Human Rights, with Zaidi Sahulat, with Benefit Income Support Program, with Pakistan Bureau of Statistics, with Ministry of Education, IT, and we, over the past 1.5 years, 20 months, I told them that, look, I don't need any money, nor would I take this project to a third donor, which usually happens. All I need is that you spare your own experts within the government system to become a part of a research and development group, which we established. For example, Ministry of Health, we asked them to ask National Institute of Rehabilitation Medicine, PIMS, Health Services Academy, to be Islamabad Health Regulatory Authority to be part of our research and development group. Likewise, in Ministry of Human Rights, their CRPD, which is a Council for the Rights of Protection of Rights of Disability, they are with us. Similarly, BISP also. So what we have done over the past 20 months is that we have we have digitized the data of all the disabled people, which was manual in the term that the people who have been given disability certificates, and we have made them an MIS, which is working as a backbone of an integrated social welfare system for Islamabad. The first priority is disabled. There we have shifted the medical assessment board from Chak Shahzad, where no public transport was going, to Niram, which is well served. This whole edifice is established on the vision that government should provide proactive service which is disability sensitive, and they should do it efficiently. So if there would be time, we would talk more about that. So that integrated social welfare system is in place now, under development by NITB. It would be connected with other service providers. We have been asked by BISP to propose packages for the disabled and elderly, which we have done. We are working with Zaidi Sahulat program to, they don't have anything on disability except prosthetics. So we are working with them also on that. And due to our work, you can say, or to benefit from the research and development group, the Ministry of Human Rights has established a grievance redressal committee, Elderly Grievance Redressal Committee, which is stipulated under the Islamabad Senior Citizen Act 2021 that Madam talked about. So I'm the chair of the committee, and Dr. Asghar Zaidi is one of the members, and then Dr. Rizwan Taj, a psychiatrist, is also a member of that committee, which is doing its work. We have already submitted a proposal to the ministry about the policy gaps and recommendations gaps, and I'll take a little longer to talk about that. So with this background, I'm particularly happy that your forum would also make a contribution to the common cause of improving the elderly care. We are working in Islamabad, but we hope that our model would be replicated in other places also. Now, what is the major problem with the Islamabad Senior Citizen Act? Madam was kind in saying that it's a better act. I would not say anything on that because the potential is far from realized. So I'll just hold my judgment. Number one, the basic issue when it comes to elderly care in Pakistan is that of vision. Now, are we talking more about rights or are we talking about comprehensive care? Now, we usually copy the UN conventions, and the countries which are in the forefront of these UN conventions, like let's say Europeans, they do not have an issue with the basic provision of care in terms of health, let's say, or social security coverage. Now, in their case, the question does not arise that an elderly would be without any financial or health protection. Now, as they do not have an issue with the financial protection of elderly or health, they talk more about the rights. Now, in our case, in our own understanding, rights are important. Nobody should be evicted from the property. If you give property to the children and they turn against you, you can restitute that. So rights are important in terms of inheritance, in terms of abandonment. Dignity is rather vague in general, but I would say that in our case, the major problem is that of health. And that brings me to the second issue of visioning the old age in Pakistan. You asked Dr. Zaidi a question that who is old? Now, this is an extremely important question. He rightly responded that it's 60 for the government, 65 in terms of availing many benefits that the government gives, which are given in Islamabad Senior Citizen Act also. But if you look at another data point, which is the healthy life expectancy. Now, our average, the life expectancy at birth is slightly more than 66. It's around 67. But the real significance is that of the data of the healthy life expectancy. Now, the disease cluster which hits the Japanese at the age of 75 hits us at the age of 55. Now, our healthy life expectancy is around 57. And if you disaggregate this data by socioeconomic status and women, the poor people, for them, life expectancy is early 50s, and for the women in the poor household, it's late 40s. Now, what does it mean? Long years of disability and disease due to lower life expectancy. Life expectancy, healthy life expectancy, that's the right word. Now, how have we arrived here? By not providing adequate social protection to our population in general, particularly health, which basically means that our populations suffer due to ill health, and health becomes a major vector for bringing down the healthy life expectancy. So there, our labor cannot work in 50s. We talk so much about the demographic dividend, but we are spoiling the demographic dividend when our people cannot work in 50s, and a household spends more than it earns. This is a serious data point. In the poorer households, they spend more than they earn on health. It's 100% plus their primary income. So in that sense, in our visions, while drafting the Senior Citizen Acts, we have all those handicaps that Madam has pointed out, that they are designed by people who have different kind of objectives. But we should be clear that when it comes to the older population, care is the primary focus that we should have. Now, what the approach that we are suggesting is that taking the lifespan approach, what we have observed is that the worst in the elderly population are the people who either have chronic diseases or have disability. Now, in all over the world, the severe cases of disability are taken care by the state. If you have dementia-driven disability in a poorer household, there is absolutely no way that they can take care of that, or hire a nurse or spare one person to take care of that. Now, in so many countries, there is a concept of cash for care, because if one person is leaving her job and is attending the elderly, that also has a cost. Our old age laws have little on prevention as such. Now, getting quickly to the policy gaps, the Senior Citizen Act 2021 has given kind of policies. Now, but when we look at the policy responses that they have given to the challenge, without, I would say, quantifying the social protection needs of the elderly, they are just copied from somewhere. Madam has amply highlighted the significance or bad intentions of giving funds a central importance. And then the other policy response is that they say that we would make Daru Shafqat. That's the second policy intervention that the Act stipulates. And then they say that we would make a Senior Citizen Act, a Senior Citizen Card. And the fourth one is that they say that we would make a Grievance Redressal Committee. Now, what is the status of implementation? Fund is not yet established, because the council has not met since long. The council met, I think, in September 2023. After that, the council has not yet met. One good thing, or whatever thing that council did in September 2023, was to establish this Grievance Redressal Committee. But as the rules of the council are not yet formulated, the rules of the Elderly Grievance Redressal Committee are also not made. So in the meantime, we have been working on the policy side, but we are waiting for the rules to be made, because one of the major policy response of the Senior Citizen Act is to stipulate heavy penalties for medical negligence of the elderly in the hospitals. But you need rules for that, which are not yet made. Daru Shafqat is nowhere to be seen because fund is not there. So Daru Shafqat is not there. That is still a very large subject, that what kind of shelters do we need, that is there. Citizen cards, not done yet. And we are still talking that when we have CNIC, do we really need a new card? I can later on share the list of benefits that should come through the card, but they have kind of linked those with the card. So the implementation status of Senior Citizen Act needs much more to be desired. But I would say, agreeing with Madam, that the problem is basically with design. When you design things on fashions, this is what happens. Now, what is the way forward? That's the last part of my presentation. The way we look at is that given our resource constraints and lack of will, lack of clarity, and fragmentation that we have done, we are stuck in a bad situation where, if we are able to provide for the worst cases, worst vulnerability among elderly, that would be a big thing. Now, there in that case, what we are suggesting to the government, that as we do not have a comprehensive social security, so our elderly face acute financial vulnerability and health vulnerability. Now, Punjab has started giving some little stipend to the elderly, which is a good thing that they have done. But otherwise, what we have to rethink is that BISP is using still family as a major unit of analysis to give the Benazir Kafalat. Now, you give it to the household, 3,500 roughly at present per month. And given the inflation which has taken place, they say that this is poverty reducing measure. In 3,500 rupees, you cannot put even food for an average household on the table for 10 days. So forget about the poverty. And then with this 3,500, you cannot adequately take care of the food. But how much would you spend on the elderly? How much would you spend if you have a disabled in the family? And how much would you spend on the children, let's say girl children or other children? They have this Wasila facility, that Wasila Taaleem would go for the, let's say, children. Now they have started giving stipends for the people who have a disability certificate, but their percentage is very low, because there again they have done a thing which they should not have done, that they've linked the availability of stipend to the holders of special CNIC, which is not even 1%. And we should also realize that usually people go to get the disability certificate to get the jobs. So we are stuck with the 1981 Act, which basically was aimed at giving more employment to the people who are disabled but can work. Most of our elderly who are disabled by any definition do not have the disability certificate to make them avail any of the facilities which are there. Now, the facilities which they have provided a list in the Senior Citizen Act is long. I'll just talk about the one which is about the health. So they say that you can go and avail health facility from any government entity, but we all know that what happens in the government hospitals. Now, what we are suggesting to the government is that if we focus on the older people who are suffering from severe disability, we should combine the efforts of Sehat Sahulat program and Benazir Income Support program, and we should start cash for care program, both for home care as well as for the care provided by, let's say, privately built shelter houses or by NGOs. We gave 15,000 rupees to a disabled who needs assisted living round the clock. Assisted living round the clock is the defining element. And as everybody cannot take care of such cases, we should have the option of houses, whatever you call them. And there in those houses, you should have the hospice care, you should have the health care, therapies, and some social space. According to our own survey, 32% of the older people do not have access to medicine, and 30% people do not have the access to nutritious food. And 28% of the parents of the older people in Pakistan are living alone. And the single old living alone in Karachi, according to our data, is 8%. So there we have to come up with a solution that even if the care provider has to go away or is really psychologically under pressure, so the home care provision could shift. The Buzurg can go to the shelter, then come back and make it more flexible. So there, if we adopt this kind of a scheme, then we have proposed the establishment of counseling services. In Maharashtra, India, for example, the police has been asked to visit every household which has elderly to check on their state, to check about the violence, about the rights, about all those things. So we need to activate newly designed social welfare services which bring in the voluntary services or universities or internees for that. So that is the minimum that we should do, that we should define, quantify the population segment, which is the responsibility of the government, and then put in place a proper scheme to take care of them. I think I should stop here, and if there are any questions, the last thing I would like to do is that Army is experimenting with a model, or in Pindi, I'm told that they take 50% of your pension, and in exchange of that 50%, they take comprehensive care of you, including food. If you're sick, they provide a space, and you can use 50% of your pension yourself. Now, there are models available. There are many insurance models available. Our middle class is suffering due to the heavy care burden of the elderly, but we are not even able to take care of the worst cases of need. What to talk about the middle class? Thank you.
Thank you, Dr. Safdar. A very comprehensive presentation and talk. You highlighted two problems basically. One is financial and other is the health problem. And health card is, I think, a more dignified way of providing health facilities to the senior citizens. There is another aspect also, which is our national problem, that the focus is not on health itself. It is on not focus is not on prevention, but rather than cure. Anything happening, people rush to the hospital. I was reading the other day that in London, if you're on social security and you go to the hospital in emergency, journal waiting period is 9 hours. And after 9 hours, they'll tell you, okay, you can take paracetamol, and if this happens, come again. So there has to be a system in the household, at home, take care of minor problems like flu and these things. And elderly care should start at home in our case. People tend to rush to the hospitals, to the doctors for everything, which is bad. And thus the overconsumption of drugs and medicines. You mentioned, Doctor, in lighter vein, this Maharashtra model of sending police to the household, checking that how the elderly are doing. Please don't do it in Pakistan because the children have a lot of problems then. So you have to see your own society, how we are structured, how we are behaving, and then we can suggest it was on the lighter side. But yes, you are right that society has a responsibility and then the state has the responsibility. You talked about the system which has been introduced by Army. Yes, anybody, any officer or from the ranks, if is above 70, he can give half or surrender his half of his pension, and he will be given a very good accommodation. And this accommodation has been placed near the hospital, main hospital. So that is a good. This model can be followed elsewhere also. Now, thank you very much, everybody. Now we'll have a round of, we don't have questions because we are not live, but we have few minutes to generate a discussion. And I'll start. Yes, sir. Yes, sir. Dear Dr. Asghar, please.
I'm just reflecting on what Dr. Safdar was saying. I remember that Alzheimer's Pakistan in Lahore is offering a very good daycare service facilities. And the idea is that at one point, children can bring their parents who are suffering from dementia, and then the patients stay for the whole day in the daycare center. It is provided free of charge by Alzheimer's Pakistan. And it has produced really remarkable results that people who were drooling and who could not remember their own name and had very little bathroom ethics, within a month of visiting daycare center, they improve remarkably in their communication, in their understanding of their environment and all that. That basically shows that when there are interventions in place, good interventions in place, which are human-centered, then even the worst case scenario of people in advanced stages of dementia, they respond, they get stimulated to start loving their life again and have a better quality of life. So I think there's a great hope that if we could come up with such care provisions, then quality of care for our elder will improve. There is no doubt life expectancy will continue improving, partly because of the medicine, because the doctor will come and inject something, and then the patient would be alive for another few months. So so we need to really not only continue depending on those kinds of medicine, but also continue thinking in terms of quality of life. And sometimes and death is a relief from the pain that people suffer.
Dr. Saab, another aspect related to the point you raised, if we are talking about the longevity in age, but the kind of food in our country, I'm talking about Pakistan, the kind of food we people are having adulterated, which is not the quality of food has deteriorated. And there is stunted growth because then these people, when they become elders, yes, they can have longevity of age, but their health would not be the same as of the elders now. This is one. Would you like to comment on this?
Yeah, in fact, we should be looking at the change in healthy life expectancy. So there is a statistics on how long people live in good health, not just how long people live. So that should be looked at. That should be compared from previous times, and that also shows that it is increasing. Not all of the increase in life expectancy is spent in good health, but a good portion, as much as half of the increase in life expectancy is spent in good health. So that's good news. So basically, one phenomenon that we really need to continue drumming up. Healthy aging is a life course phenomenon. It's not a phenomenon we should be worried about in old age. We have to really bring awareness that young people need to eat better, and young people need to do better exercise, young people need to have better social connections, and especially middle age, those people who are approaching the retirement. Many of us are very fortunate that we, beyond retirement, we continue to find good activities. But people really struggle. Some people struggle, large majority of people struggle, that they find a good positive activity to engage with, and that has a very serious adverse effect on their health.
Sir, I would like to pose a question to Mr. Shafqaat. This maintaining healthy activity, I am speaking from my personal experience since I have been a soldier and a commando, and I continued my strenuous exercises like 1 hour swimming and jogging and all. And I started developing, body aches here and there. And then I was advised that you tone it down. And now I'm pretty okay. So, how would you like to comment on this, sir? सर माइक जरा ऑन कर लीजिए सर माइक ऑन कीजिए हमने तो नहीं किया वो सर आपका माइक ऑफ है जी अभी ऑन हो
Gee, I mean, healthy activity at the later stage or as a senior citizen is very important, as everybody has mentioned. और उसके अंदर there are a lot of things one can do. और मतलब I regularly play golf, and what I've seen in the golf course, there are people who are 83, 84. They are regularly play golf, and they play 18 holes, which is require at least 4.5, 5 hours. and without any golf cart or buggy, they play on foot. So, and they have been doing it for regularly for a long time. So they basically golf is physical, mental, and on the lighter side, when you are playing with somebody, you become your real self. वो जो एक मसनूई आपने लिबादा ओढ़ा होता है ना, वो खत्म हो जाता है, एंड यू बिहेव लाइक योर रियल सेल्फ. जिस तरह स्कूल के बच्चे ये होते हैं, उसके अंदर हंसी मजाक भी होता है, ये भी
वालेकुम
होता
सलाम.
है, which is very good for people, for the senior citizens, because as uh, my panelists have also mentioned in their talk and presentation, कि एक उनकी सबसे बड़ी चीज जो होती है, दैट इज द लोनलीनेस. फैमिली के पास भी इतना वक्त नहीं होता, बच्चे काम पे होते हैं, बाकी चीजें सारी, और कहीं ना कहीं ये आउटलेट जो है ना, ये बहुत ज़रूरी बन जाता है. और 3-4 घंटे वो गोल्फ पे अगर खेल रहे हैं, उसके बाद बैठ के चाय पी, पानी पिया, और एक दूसरे से हंसी मजाक बातें की, तो दिस इज ऑक्सीजन फॉर हिम. और उससे उसकी मेरा ख्याल है कि नॉट ओनली द फिजिकल बट द मेंटल हेल्थ आल्सो improves, and he becomes a much healthier person than a person who is spending his old age in one room in the house. किसी ने आके खाना दे दिया, किसी ने कुछ पूछ लिया, किसी ने नहीं, तो सारा दिन वो टीवी देखता रहा. टीवी लगा दिया बच्चों ने कि जी आप टीवी से दिल बहला लें, तो वो एक बड़ा मुश्किल काम होता है. मैं अभी आई रेगुलरली गो टू क्लब. मैंने अभी देखा, दिस इज माय ऑब्जर्वेशन, कि सुबह आप 9-10 बजे के करीब एक खातून होगी और उसके साथ एक बूढ़ा कपल होगा, मियाँ बीवी. वो आके उनको क्लब में उतार देते हैं, और फिर 3-4 बजे आके वापस फिर वो उनको ले जाएंगे. आई मीन, ये कोई पेरेंट्स हैं जो बेटे के साथ के वहाँ रह रहे हैं, तो इंस्टेड ऑफ ऑल डे दे आर स्पेंडिंग इन देयर हाउस, तो घर वाले उनको क्लब में छोड़ देते हैं. क्लब में कहीं वो लाइब्रेरी में जाते हैं, कहीं और एक्टिविटी है, कुछ और लोगों से मिल लिया, कहीं पे कुछ थोड़ा बहुत खा लिया, सूप वगैरह. तो दिस इज हाउ दे आर स्पेंडिंग देयर डे. और उसके अंदर घर में भी वो जो खातून होगी, उनकी बहू या बेटी, वट एवर इट इज, वो भी बच जाती होगी, क्योंकि घर में बैठ के वो हर चीज पे आप कोई ना कोई सवाल करते रहेंगे कि तुम किधर जा रहे हो, क्यों आए हो, क्या कर रहे हो, ऊपर क्यों जा रहे हो, नीचे क्यों आ रहे हो. तो इन चीजों से, तो ये एक यू हैव टू क्रिएट एनवायरनमेंट, एक एटमॉस्फेयर कंजीनियल, जिसके अंदर उनको भी फायदा हो, उनके डिपेंडेंट्स को भी फायदा हो. और इस तरह से एक बड़ा हेल्दी सा एक एनवायरनमेंट बन जाता है, कि जिसके अंदर जो बुजुर्गान हैं वो अच्छी जिंदगी गुजारते हैं, और बच्चे अपनी उनकी जो आज़ादी में कोई मुखल भी नहीं होते ये बुजुर्ग. तो इट हैज़ टू बी बैलेंस्ड. और इसके अलावा सबसे बड़ी बात, जैसे पहले भी मेरा ख्याल है सबने ही की है, कि सबसे बड़ी चीज फाइनेंशियल स्टेबिलिटी है. वो अगर बंदा फाइनेंशियली साउंड है या और चीजें हैं, तो वो बहुत से मसाइल का जो हल है ना, वो स्टार्ट ही उस वहां से होता है और वहीं पे खत्म होता है. तो ये बड़ा जरूरी है. और हमारे यहाँ भी अगर गवर्नमेंट इसको देखे, जिस तरह से डॉक्टर साहब ने रेकमेंड किया है कि नेशनल कमीशन ऑन एजिंग एंड ऑल दिस ये बन जाए, और हम उनकी जो माली ज़रूरियात होती हैं इस एज में, उनको अगर पूरा करें, तो हम बहुत से उनके मसाइल को हल कर लेंगे. तो रूट कॉज स्पेशली इन अ कंट्री लाइक आर्स इज द फाइनेंशियल. हर जगह के अंदर एक नॉर्मल जिंदगी में भी आप देख लें, एक कपल की या एक और किसी की, ये बुढ़ापे में तो बहुत ज्यादा हो जाता है. तो हर जगह पे ये जो फाइनेंशियल एस्पेक्ट है, इट इज वेरी इंपॉर्टेंट. and government has to do something to take care of the especially सीनियर सिटीजन। और हमारे यहाँ तो बहुत एज डॉक्टर साहब की स्लाइड में था कि 6.9%। अब 6.9 में से जरूरतमंद होंगे वो और कम हो जाएंगे, 3% होंगे, 2% होंगे, इससे ज्यादा नहीं होंगे। which government can easily look after and give them a healthy aging. Thank you.
मैडम आपसे मेरा दो सवाल है। एक तो ये कि ऑन द लाइटर साइड ख्वातीन की जो पॉपुलेशन बढ़ती जाएगी, लॉन्गेविटी, इससे कोई सोशल सेक्टर मतलब हमारी सोसाइटी पे कोई असर पड़ेगा? एक तो ये देयर इज अ लाइटर साइड टू इट एंड देयर इज अ सीरियस साइड टू इट आल्सो। और दूसरा, एक जनरली इट इज सेड दैट legislations, policies are all perfect. They are not with any malice. They are made, but the implementation is a problem. And Dr. Safdar ने भी इस बारे में बताया था. Please answer these two questions. मैडम, आपने जवाब जी आप अभी आवाज ऊंची कर लीजिए। मैंने दो सवाल किए। एक जी, first is that when the female population is more because वो मर्द ज्यादा, ये तो हो गया। दूसरा, implementation gap तो है, but the point is what is the solution then? Dr. Safdar gave some, we'd like to have your views also.
Of course, already women, especially in the urban areas or in the very rural areas, they've started making their groups already. To a large degree, the younger population has also been able to rope in the older ladies. So elderly ladies जो हैं अब वो भी अपने phones, WhatsApp groups, ये सारी चीजों में मुलव्वस हो गए. So there is a huge amount of socializing among the older women. And they talk to each other, discuss with each other. This interaction is extremely important psychologically, frankly. So that keeps them alive, that keeps them going. And as long as they are involved, then that fear that we have, that the women could become a problem, well, it's less. This is one of the reasons, because of the interaction. Women talk quickly and they discuss with each other, they keep in touch with each other. I think that is a key to this aspect. But when it comes to implementation, with due apology, Haroon Sahab, the manner in which, when you actually use the law, you will find you can do nothing. The manner in which, for instance, let's put it like this, they've taken the Islamabad Act. They say, section 19, violation of directions of the council. Aapne violate kiya, you're automatically going to be face criminal prosecution. Okay, under the Pakistan Penal Code. Great. Usme kya hai? Proviso. Provided that no action shall be taken under this section other than in cases of emergency, unless 15 days notice has been given. So if somebody doesn't want this to happen, they just block it by not giving the notice. There are very clever items already in the system. So if you really try to work it, you're going to block blockages. Grievance committee को देख लीजिए. Grievance committee जो है, उसने अगर काम नहीं किया, तो उसकी अपील कहाँ जाएगी? Council को जाएगी. They're all involved. They have set up the grievance committee. Now, if they decide, their decision shall be final. So in other words, in-house रह जाता है. There is no accountability of what happens. There's no third-party pressure. And the moment you make it in-house, corruption will occur, lethargy will occur, inaction will occur, and you can have an amount of grievances, and you're going to end up just like the ombudsman. He's got hundreds and hundreds of cases and really not much traction. So we have to create systems that can have traction. And we don't. We have blockages through the system. We also don't have funds because you have a more state control mindset in the country. You are not really moving into private enterprise, which we have. We have the greatest of private entrepreneurs in Pakistan. They have tremendous ability to
Thank you, Dr.
industry and businesses. हमारे यहाँ के फंस जाते हैं.
जी अच्छा अभी what we'll do is that we'll just have a round for concluding comments so that we can wind up. So we'll start with Dr. Safdar. Sir, your concluding comment.
Yeah, the discussion has been excellent, and a lot of colleagues have given their input also. We because we work regularly on these issues, so for me, the discussions have given a lot of good ideas also. And this reiteration that financial protection is one of the most important areas. So that one is one such objective, one would say, that all of us should put our hands together. Punjab has started giving monthly support, and they have restarted. They used to have once before. And I know that there was a survey which informed it was 2,000 rupees a month. That after the poor old parents started getting the stipend, their respect at home significantly increased. There was a whole change in the environment because the Buzurg was bringing little amount of money. Uh, we have a data that 76% of older people in Pakistan do not have any kind of pension, any kind of pension. So this is huge. And if you look at the labor force survey in Sindh, people even in 70s are still looking for the jobs. That is the extent of vulnerability. So that is one that should be one of our major objectives, that to devise a scheme that it could be need based, of course, but that is one. The second one is about health. On health, we have multiple problems, but if the disability could be taken care of, in particular, and the hospice care. Now, in terms of hospice care, our facilities are very poor. Our private sector hospitals keep on dragging their feet because they're getting a lot of money. So there, it's government which needs to come up to establish the hospice facilities, as we are proposing to the Sehat Sahulat program, that the terminally ill people should be taken care of. Now, all that we are talking about is to take a life cycle approach and reduce the burden of the household by shifting some burden to the state, particularly in the cases which are the most vulnerable, which are the disabled ones. Now, about the implementation gap, Senator Saiba has amply pointed it out. Now, we need champions to come over the problems, like maybe standing committees of the National Assembly and Senate. They can ask questions that there is a law which is there for the last 4 years, but not implemented almost at all. I agree with her comment on the grievance committee also, that unfortunately is the usual practice, but still they appointed these three people as members of the Islamabad Elderly Grievance Redressal Committee on the basis of the work that we have been doing. Dr. Asghar Zaidi sahab knows about our work, and we have been working together right from the beginning. So we are good in making laws, but not quality laws, and then the policy responses are poor. And even when some policies are there, we fail on the implementation, and the socioeconomic costs are huge. So the issue of elderly care needs a much better policy traction, much more contribution by the think tanks, by the civil society, and bringing in the parliament into that, so that this is taken seriously. Buzurg are suffering at home, particularly in poor households. And then the last thing, awareness is not there. You talked about the need or possibility of giving some kind of a primary health support at home. So now that requires awareness कि लोगों को बताया जाए कि भी हर चीज के लिए आप भाग के हॉस्पिटल नहीं जाएं, छोटी चीजें, टिप्स जो हैं. Our own mother-in-law had dementia, and every afternoon she would be at the door with the bag that I want to go to the gaon. And then somebody told us that, look, I mean, in the afternoon, dementia patients have higher level of anxiety. So at that time, just put her in the car, take her around for 1 hour, and then she would be okay. And we really benefited from this small tip. So in terms of awareness, I think in case of dementia, in case of home care, extremely important. And whenever I go and talk to different forums, I ask them, young people, that do you put some money in your father's or mother's pocket? They said कि नहीं जी वो घर में खुश हैं, वो उनकी हर जरूरत पूरी होती है. And I tell them that look, उनकी ये भी कोई जरूरत मटेरियल नहीं है. ये हो सकता है अपने ग्रैंड चिल्ड्रन को उन्होंने चिप्स ही लेके देने हो, लेकिन अगर 5-10 हजार हर महीने उनकी जेब में डालेंगे तो दे वुड फील फाइनेंशियली सिक्योर कि कोई इमरजेंसी ना हो जाए, दुकान पे जाने को जी करता है. और ये उनको एक रीअश्योर करेगा कि जी यू आर टेकिंग केयर ऑफ देम. और 5-10 हजार तक बड़ी चीज नहीं है. तो छोटी छोटी चीजें जो हैं दैट कैन ऑल्सो help awareness, but small time things would make a small time difference. We have bigger issues which we need to address. Thank you.
Thank you. Dr. Asghar, please, your short concluding comment.
I'll try to keep it short. I think two aspects come from my presentation. One is the advocacy of good policies and healthy aging agenda at the global level provide us good sense of what policy reforms, what adaptation of our public policies need to be made. And I think for that purpose, there is a strong recommendation that a National Commission on Aging should be formulated, because that would then be able to review which public policy need adoption and adaptation. The second thing is for the society as a whole to look into, and I think we need to make raise better awareness towards the phenomenon of ageism. In many different ways, older persons are suffering because there is an inherent ageism in our system, in our behaviors. So we need to raise awareness about how that is affecting, how the phenomenon of ageism in Pakistan is affecting older persons, and what can be done to improve it. Third, if you allow me just one more recommendation, I think we need better data. Whenever we come round to looking at statistics, we often do not have a good nationally representative survey on older persons. Almost all countries now have a good survey on older persons. We need to have a specialized survey on older persons that is nationally representative, because that would provide us the data and that would make our policies more evidence informed. Thank you.
Thank you, Doctor. Madam, your concluding comments, please.
Speak up.
Speak. अपना mic on कीजिए. अपना mic on कीजिए. Connection problem भी है.
नहीं, mic बंद है.
Beg your pardon, I
जी, madam. जी, your comments.
Yes, let me clarify. I'm not a senator. I've never been a senator. Actually, I was a part of Musharraf's government, and that's where I got the opportunity to be the law minister, both at the federal and then at the provincial level. Provincial and then federal, and then later in the caretaker cabinet. So therefore, I do not have parliamentary, let's say, experience in that sense. I'm also not a doctor, a PhD, I'm a barrister. So if you don't mind, it's just to be there to let you know that. What I would suggest is we need to have enabling legal structures. The law must enable, not obstruct, or not obfuscate, not be vague. It has to be sensible. It has to be focused. It has to give the power and give the accountability so that it functions in a transparent and responsible manner. Secondly, with due apology, National Commission on Aging, I think, would become a problem because we've got the 18th Amendment, and with it, the federal legislative list has now sent it to the provinces. So there's a part 1, there's a part 2, and the part 2 goes into the Council of Common Interests, and which means all 4 provinces can sit down with the federal government and have a row over it. They may dispute it, etc. So I don't know how the National Commission would function because, you know, we have a lot of provincial aggression going on about sovereignty and whatever. So just keep that in mind, Dr. Saab, so that you don't hit a blank wall. We'll have to find a way to go around that wall. And I think you need to bring in the private sector. Pakistan is known for philanthropy. If you bring the private sector in and they become the philanthropics, they will be able to fund these things because they have to be given this option to fund. And if they fund them, you will find Salani Trust hai. Look at the way they function. Look at the Islamic Welfare Trust. Look at the way they function. I think we need to look at that model and start bringing the philanthropists, because Pakistan is known to be a philanthropic nation, but they're silent, they're quiet, they don't like to get involved because they are fed up of government interference. So we have to bring a balance in that. And I think otherwise it'll be tremendous. Thank you.
Thank you. Mr. Shafqaat, sir, your
Thank you,
concluding
Jan sir.
comments.
अब वो जो मैंने स्टार्ट में कहा था आखिर में मेरी बारी आ गई. डॉक्टर सफदर साहब, डॉक्टर असगर साहब, बैरिस्टर शाहिदा, इन्होंने सारी चीज़ें जो थीं आज के टॉपिक के बारे में they have covered it very well. I would just like to add के मतलब है कि हर चीज़ में गवर्नमेंट से काम कराने के लिए कुछ लॉबिंग होती है, कुछ प्रेशर ग्रुप्स होते हैं. यहाँ पे भी अगर सीनियर सिटीजन्स का कोई ऐसे प्रेशर ग्रुप बन जाएं जो कि लॉबी कर सकें पार्लियामेंटेरियन के साथ और गवर्नमेंट के इदारों के साथ, ताकि जो कानून है कम से कम वो तो इम्प्लीमेंट हो और जो कानून नहीं है उसको बनवाने की कोशिश करें. अब ये कवानीन जैसे बैरिस्टर शाहिदा ने कहा है कि सेंटर की बजाय अब ये प्रोविंशियल सब्जेक्ट है, प्रोविंसेस में बनेगा, तो प्रोविंशियल में बनाने में मेरा ख्याल है थोड़ी सी और आसानी हो जाती है कि एक्सेस उतनी मुश्किल नहीं जितनी सेंटर की होती है. तो ये वी शुड ऑल ट्राई कि हमारे जो सीनियर सिटीजन्स हैं वो भी उस बराबर आ जाएं जहाँ दुनिया के दूसरे ममालिक में उनके लिए जो इतना कुछ फैसिलिटीज़ हैं. हमारे यहाँ किताबों में लिखी चीज़ें बेशुमार हैं लेकिन इम्प्लीमेंट नहीं होता. So implementation is a major issue in our country, not only in this regard, but in every field. हर जगह के ऊपर कानून हमारे पास बेहतरीन हैं, बहुत अच्छे हैं, लेकिन उनकी इम्प्लीमेंटेशन करने के लिए वो लोग नहीं हैं जो ये काम कर सकें, वो बेलॉस किस्म के लोग. वो हमें अच्छे लोग चाहिए जो ये सारे काम कर सकें और हर फील्ड के अंदर कुछ ना कुछ जो है काम करने के लिए हुकूमत को मजबूर करना पड़ेगा, प्रेशर ग्रुप बनाने पड़ेंगे, काम करवाने पड़ेंगे. प्राइवेट सेक्टर हैज़ प्लेड अ मेजर रोल. बैरिस्टर शाहिदा ने कहा लाहौर के अंदर आई हैव myself visited 3 old people homes which are run by private people and they are माशाल्लाह बहुत अच्छे बने हुए हैं और बहुत अच्छे क्वालिटी लाइफ जिंदगी उनको जो लाइफस्टाइल दिया जाता है वहाँ पे वो भी बड़ा ज़बरदस्त है. तो इसको भी इनकरेज करना चाहिए और साथ साथ लेकिन जो हमारी हुकूमत का जिम्मेदारी है उनको भी चाहिए कि वो भी अपनी जिम्मेदारी को अच्छी तरह से निभाएं और इस दिस स्मॉल सेगमेंट ऑफ सोसाइटी इज बीइंग लुक्ड आफ्टर प्रॉपरली और जो उनकी ज़रूरियात हैं उनको पूरा किया जाए. Thank you, Jan sir. Thank you.
Thank you, sir. Thank you, everybody. I'll just, in conclusion, I would just like to submit, firstly, very grateful to everybody that such a enlightened panel, experienced panel, very well qualified panel, and a balanced panel. We had very good discussion. The purpose of the seminar was basically policy advocacy, because that's what we do. What we'll form a report, a webinar, and maybe somebody listens to us without exercising pressure or lobbying. And otherwise also, for those people who watch this webinar, there are youngsters, there are elderly peoples, and particularly what guidelines Mr. Shafqaat gave, how to take care of yourself as an elder and how the children should be taking care of you as an elder. This There are certain people, there are, we have haves and have nots, there are underprivileged people. For that, this webinar would serve the purpose of implementing or at least formulating some policies which can take care of our elders. I, being a soldier, believe in simple things. This health card, just change the color identity of the basic national ID card. Give after 70, give it a different color. And if that color means the access to the hospitals, access everywhere, priority, that would solve that. We don't need a healthcare. Just change the, and it's very simple. And a very important point is that after 18th Amendment, believe you me, uh, the federal government can take good care of its elders within the territory of Islamabad capital. So these are the provincial governments, those have to act. And certainly along with the society, we have to revert back to that. एक बोर्ड का दरख्त होता था जिस पे सारे बैठ जाते थे, हुक्का पीते थे मोहल्ले में किसी। एक और वेरी इंपॉर्टेंट जो एक रेलिंग पॉइंट है, दैट इज द मॉस्क। जो रेगुलरली मस्जिद में नमाज पढ़ते हैं उनका भी एक ग्रुप है। वो लोग मस्जिद में इकट्ठे होते हैं, मॉर्निंग वॉक करते हैं, फिर असर के बाद इकट्ठे होते हैं, मगरिब के बाद इकट्ठे होते हैं। सो we should cling on to our values also. Those are very important. Rather, our new generation should be told that what are the values of taking care of our elders. With this, sir, madam, thank you very much. Have a great day.